Today we're here at Great Lakes Imaging. I'm with Dr. Jason Prechak. Thanks so much for having us.
Yeah, you're welcome. Thank you.
Why don't you tell us what you do here?
So I'm a diagnostic radiologist by training, additional fellowship training in breast imaging and women's breast health care. So at this center, we're really a comprehensive center, and really from the minute somebody checks in, sometimes they're here for a screening mammogram, sometimes for a specific breast complaint. And those complaints could include a lump or nipple discharge, or maybe just diffuse breast pain or focal pain. So at that point, we kind of determine what the best imaging modalities would be, and sometimes that includes starting with a mammogram and breast ultrasound and kind of moving on from there.
Absolutely. Obviously, we're here in October celebrating Breast Cancer Awareness Month. Why is it so important for women to get screened and get their mammograms?
Well, early detection is key. We want to find that breast tumor if there is one present in a much smaller size, as opposed to presenting it at a later stage where the tumor is larger and then there's risk for spread to other organs, including underneath the arm and the axillary region, or to other solid organs in the body. A breast can go to bone sometimes, can go to liver and lung and other areas.
Absolutely. Now, like you said, early detection is key, but there are some people that notice things, and you sort of touched on it, but tell me more about the complaints that people have that can lead them to want to get their mammograms.
Yeah, sure. So if you have a breast complaint, take it seriously. I would not write it off. Talk to your primary physician. Go and see them and get a script for the appropriate imaging. And these include lumps, pain, nipple discharge. I always encourage to do a monthly self-breast exam and to be aware of complaints like that, and that would lead to an appropriate imaging workup in a timely fashion.
And let's talk about genetic testing for eligible women. How does that work? Yeah,
so part of from when the check-in process to the registration process is you fill out a 2-page breast health questionnaire, and on that is a lot of the family history as far as hereditary type of cancers, which usually include prostate, breast, ovarian, colorectal, melanoma, and some other ones as well. And then we go through a process once you fill out that and complete that questionnaire to see if you're eligible for genetic testing. The genetic testing is a simple saliva sample. It can be done right in the office after all the imaging is done that day, if the woman consents. And then usually we have results back in 1 to 2 weeks, and that tells if there's a mutation present that would, place the patient at increased risk for a solid tumor down the line. So, and then if that is the case, we can make the appropriate referrals to physicians and for appropriate imaging protocols to kind of follow that up.
And that leads us to the breast cancer risk assessment, right?
Correct. Separate than kind of, whether somebody's eligible for genetic testing or not would be the risk assessment. And that would be, once the questionnaire is completed, we then, from a computational model called Tyrer-Cuzick, we then compute whether somebody's an elevated risk score for breast cancer. Typically on the questionnaire, once everything's completed, if that means a 20 to 25% risk score or above, at that point then we could offer adjunct high-risk imaging such as a breast MRI or other types of things. Sometimes if somebody has high risk or they have known dense breast tissue, we add on a breast ultrasound and other studies.
Going in and getting your screening and getting your mammogram can be so scary for some people.
Sure.
How do you guys make this not only comprehensive, but kind of eases the minds of anyone that's coming in here to do what they need to do to make sure they're healthy?
Yeah, it's a great question. And that starts with the check-in process. I think we have an outstanding staff who kind of puts the patient at ease. And then from when our ultrasound tech or a mammo tech or MRI tech will, kind of first meet with the patient and kind of explain the process. A lot of patients have been here before, some have not, and they kind of walk them through that process of what to expect, what they're going to feel during certain types of exam, including compression during mammography, and kind of just answering a lot of those questions, including questions of radiation concern and other things like that. Sometimes it's positioning concerns. Can you hold a certain position for a period of time to get the appropriate images where we don't have motion artifact or other things like that? So, but we have experienced techs, and we're really lucky, and they're outstanding. They walk everybody through what to expect.
Dr. Prechak, thank you so much for having us and showing us around. It's a beautiful space.
Thank you.
You can learn more by heading over to their website at greatlakecentercare.org or by calling them at 716-884-3000.